Hello everyone and welcome back to my channel MedPharmaco Essentials. So before going forward, let us see what is migraine headache. Migraine headache is nothing but it is a condition which causes a severe throbbing kind of pain, and as well as along with the throbbing pain you also have sometimes pulsating pain also on one side of the head. That is the characteristic of this migraine headache, that is you have the headache only in the one side of head most of the times. It's often accompanied by vomiting. Sometimes you feel like vomiting, you have vomiting sometimes, and as well as you have extreme sensitivity to the light and as well as sound. Migraine attack will last for hours to days, and the pain can be so bad that it interferes into your daily activities. So moving on to migraine symptoms. So a typical migraine attack involves 4 phases. Okay, it's not just suddenly you get it and then it goes off suddenly, nothing like that. So migraine headache, no, it has 4 phases. So the 4 phases is: first one the prodrome, next is the aura, third one is the headache, and fourth one is the postdrome. So the exact progression and the symptoms will differ from person to person here. So when you see this chart, we can see that how the headache usually starts. So first is the prodrome phase. In this prodrome phase, it will last from few hours to days. Here what happens, the patient starts to become irritable. Some people have depression, some people have yawning, some people feel like increased urination, some people have craving for the food, they want to eat lots of food, so that craving will be there. And some people know they cannot bear the light or little sound also, it starts irritating them. Then some people have problem in concentrating in the work whichever they are doing. Some of them have tiredness, muscle stiffness, difficulty in speaking as well as reading, and some people have nausea, that is vomiting sensation they have, and some people also have difficulty in sleep. So these symptoms vary from person to person, which last from a few hours to few days. So next is the aura. In this aura phase, what happens, it usually lasts from 5 to 60 minutes. In this aura phase, you have visual disturbances. That means there will be some blurriness in your vision. It might be due to headache or anything. Next is temporary loss of sight. You feel like you're not able to see properly. So that feeling you have. Next, you have numbness and tingling sensations in your body parts. So next is the migraine attack. What happens, that is 4 to 72 hours it will be lasting. So here you have throbbing pain, like someone is drilling on your head, like that pain you feel. Sensation will be there, nausea will be there, vomiting, you will not be able to sleep also, and some people have nasal congestion, some people have mood swings at that time. Then you have sensitivity to the light, smell as well as sound also. Then you have neck pain and stiffness at that time. So after that there is postdrome phase that lasts from 24 to 48 hours. And this, what happens is that you are unable to concentrate fully in your work. You have little tiredness in your body, you have little mood changes in your body, and then you have all these things in the post-drome phases. So this is how the migraine attack usually starts, and then it subsides. Whom to consult when you have this migraine headache? So first of all, we go to our general physician or family physician when we have a headache usually, right? So based on your condition severity, they'll give you the medicines. They'll try for 1 week, 2 weeks. If you're not well, then they will suggest you to a neurologist. You can be referred to a neurologist from your general physician, which could be the better options for the further management. What are the steps that you can follow at your home? So first is that you need to turn off the lights whenever you have such migraine headaches. No, just turn off your lights, relax for a while, because bright light sometimes can worsen the migraine headache. So usually turn off the light and relax for a while. Second is lie down in a quiet dark room. And why I'm telling quiet dark room is because sometimes sound also can trigger the migraine. So better find a room where there is no sound, no light, and then go and relax there for a while. The migraine headache relieving cap also are available. That is cold hot therapies also are available. You can just use it. So always stay hydrated. Okay, drink as much as water you can at that time. Then drinking cumin and cardamom tea also relieves some of the pain, is scientifically proven. And do not skip the meals. You don't feel like eating actually at that point of time, but yes, you need to have at least small amount of food to avoid all the strong perfumes or fragrances, incense sticks, whatever are there, that have very strong smell. That should be avoided. Ask your people around you to just not use all those things until the pain is gone. And next is, in some people, stress also induces this migraine headache. So you need to relax, avoid stress at that period of time. And next is avoid alcohol. Alcohol can also trigger the migraine, so avoid it. And next is in some patients, heavy workout or intense workout will trigger the migraine headache. So you see that you don't work out more, that can lead to your migraine headache. So just avoid it for that time. And next is eating too much of sugary as well as processed food can also trigger migraine headaches. So avoid it. And coming to the coffee, some people say you should avoid it when you have migraine, but some people consume it when they have migraine. It actually varies, because some people, if you drink coffee, they get migraine, but some people, if you drink coffee when you have migraine, it reduces the pain. So it depends from patient to patient. We cannot exactly say that. So thanks for watching the video. Please do like, share the video and subscribe the channel.